Well, doctor, thank you so much for joining us. It's Vascular Awareness Month, and you always shed such great insight on things. So tell us a little bit about PAD. What is it exactly?
Yeah, so first of all, PAD stands for peripheral artery disease. And that's a fancy medical term, but basically, in simple terms, it means that there is poor circulation going from the heart to an organ. And typically, we think of PAD involving the legs, Maggie. So if someone has blockages or lack of blood flow to the legs, and that's what PAD means.
So, what are some warning signs that we should be on the lookout for and when we should contact you?
Yeah, great question. So the most common symptoms are the following. First of all, patients will have symptoms in their legs with exertion. So that's the distinction. If they have symptoms in their legs at rest, it's usually more vein disease. PAD, the A stands for arteries. So those symptoms happen when they're walking, when they're going up a flight of stairs. As far as what they see at home outside of the symptoms, a lot of men and women may see, hey, I just don't have much hair on my legs anymore. I should have more and I just don't. Or men, especially, may start noticing that they have some erectile dysfunction issues, and because that's a circulation problem itself. So, usually symptoms with exertion, loss of hair, or ED issues in men would be the most common symptoms, Maggie.
Geez, that's good to know. Now, are there any steps that we should be doing to prevent this?
Yeah, the same problems that happen with blockages in the legs, same risk factors apply for PAD as well. So the biggest one is smoking. A lot of people that have PAD are smokers. So smokers pay special attention. If you start noticing symptoms in your legs or loss of hair or ED issues, you definitely should get checked out. But other risk factors like diabetes, high blood pressure, high cholesterol, family history of circulation problems are huge, and people need to pay attention to that.
And how do you go about treating this?
So step one is talking to our patients and seeing if they fit into the PAD model. Number two, we examine their legs. We see how much hair they have or don't have, what their pulses feel like. And if needed, then we go to an ultrasound, Maggie, which will look at the blood flow, check for blockages, how fast the blood is flowing in these blood vessels. And if necessary, after that, if we find a severe blockages, then there are options to fix them.
So, how can we go about contacting you?
Our website is www.modernheartandvascular.com, and our phone number is 832-644-8930. Would love to help patients with PAD. That's our specialty, and we can help.
Well, doctor, as always, it was a pleasure having you on my show. Thanks so much.
Thank you, Maggie.